if it is a venous stroke, or if the patient's stroke is in case of the young, or some unusual cases, we actually did some patient's investigations. And in case of the venous stroke, we also to identify the etiology of the venous stroke, we also did some patient's investigations. So this is our actually the patient selection flowchart of the stroke registry. We were able to include about 2,000 patients in our registry, and mostly from the Dhaka Medical College and National Institute of the Neurosciences. And we followed up the patients for actually 1 year, and we found that 702, actually more than 30% died in this 1 year. And we have an ample number of the patients who lost the follow-up, and on the continuous, about 700 patients continued to follow up on registry at the 1 year. And the subtypes of the strokes, most of the subtypes of the strokes in our registry is the ischemic stroke, and it is about 50%, but worldwide it is about 80%, because we only included the hospitalized patients. So in hospitalized patients, actually the severe patients and the hemorrhage patients actually hospitalized earlier, but the mild patients or lacunar stroke patients were not hospitalized. So our data is a little bit different from the international one. And if we see the mortality of the patients, it is around actually 30%, and it varies in our institutes. As you know, most of the critical patients are admitted in the neuroscience and Dhaka Medical College, so the mortality is a little bit higher there. And who got the stroke? We found that in case of our ischemic stroke or intracerebral hemorrhage, most of the patients are a little bit elderly, but the venous stroke and the subarachnoid hemorrhage occurs in earlier, as it is explainable. And mostly the males are affected by the ischemic stroke and the intracerebral hemorrhage, but in case of the venous stroke and the subarachnoid hemorrhage, females are more affected than the male. And when the patient got the strokes, if we see the data, we found that they follow a different, a specific circadian rhythm. So there is a circadian rhythm for the occurrence of the stroke. In case of the intracerebral hemorrhage, the highest peak is in the 9 p.m. to 12 a.m. Actually, it is the late evening and in the early part of the night. And in case of the ischemic stroke, it is also occurred at this at the night. And the patient comes actually a little bit late, so in the daytime. And for the subarachnoid hemorrhage, interestingly found that the patient, most of the subarachnoid hemorrhage occurred in the late, in the evening, so rather than at night. And the venous stroke actually did not follow any circadian rhythm, and it has 2 peaks, but the patients mostly admitted in the early hours in the hospital. So from this data, what we got that there is a definite circadian rhythm for the occurrence of the stroke, and most of the patients came in the hospitals a little bit late, so we have to work up here. So there is actually we have to further explore. It's the famous saying of our teacher, that is, why me and why now? So we have to explore further. And there is a further exploration for the chronoprophylaxis and the chronotreatment. So we have to further explore these scopes. And where the patient got a stroke, we found that most of the cases, the patients were attacked at home, and some in the working places. And we also found that most of the patients admitted in the hospitals late, and the cerebral venous sinus stroke is further. Actually, it takes a lot of time to diagnose the cerebral venous sinus thrombosis. So we have to work up here. So we have to work up in the community for the early transferred to the hospitals, and we have to actually train up our doctors for early diagnosis and starting the treatment. Next one is what is the risk factor who got the stroke? We found that the patients with the hypertension are mostly associated with intracerebral hemorrhage, but in case of the ischemic stroke, diabetes, the dyslipidemia and atrial fibrillation. And the most of the cases, if we observe that these are actually modified, so launch the treatment before the occurrence of the stroke. So we have to work up here of the stroke.